Professor Doctor, you have used Velscope for at least several times, and you have looked into my own oral mucosa and amongst others. So how would you say that you have never met a Velscope trainer from Vancouver? You basically trained yourself using the online training course that was provided by Velscope. So how would you say how easy it is to learn and operate a Velscope?
It's very easy. Once you see the training video and once you know how the oral mucosa looks through Velscope, which is suspicious, you immediately get the hang of it. It's not a difficult test. It's not a difficult instrument. You just have to look into the mouth and then you have to just put the instrument in place and then look for the blackish areas. Infections look bright yellow or red, and then you can tell the patient that, look, this is nothing to worry about. But the black looking areas with the white light and with the Velscope, when you see these two lesions, you come to know that clinically you are not finding anything. The white patch is before it or after it, and the actual part which is showing this is different. And I didn't find it very difficult to do this.
So, Doctor, do you want to explain a couple of experiences when you used a Velscope? Because you had the opportunity where one of people in your network, she approached you with a very difficult case of her father, where it's a case that we have talked about earlier. But if you want to touch that case again.
Yeah, I came across one patient who is my nurse's father-in-law, who was having a ulcer on his tongue, on the lateral side of his tongue, very small, less than a centimeter. And the only complaint that he had was that he was having burning while eating. So the doctors and the general practitioners just gave him the local anesthetic agents like Smile cream or anything, and then that was the treatment going on. And because she came to know that there is test like this available, she came to me and said that, Madam, please do test on my father-in-law. And so we did, and we found 5 abnormal cells. And I think I have 30 years of experience of cytopathology, but my cytopathology slide just showed me atypical cells, clean background. So I wasn't sure whether I should tell this patient that you are going. It was just atypical, which will occur in so many cases, conditions, I mean.
Right.
So I told them that no, 5 cells are there which are abnormal, and we must do the biopsy. And to our surprise, the earliest cancer was detected. It had just invaded 2 millimeters.
2 millimeters.
Yes. And just by doing that wide local excision, the patient is absolutely fine.
So,
that is the beauty of this test.